of you will be knowing that one person in your family or friend circle who is suffering with a stroke, who are bedridden, who are having problems in walking, so on and so forth. The stroke is very common nowadays. There are a lot of people suffering from stroke, and we are planning to launch a stroke series in our PRS Neurosciences channel to educate people, create more awareness about the stroke, why stroke happens, how it is managed, and what is after the stroke. So, welcome to the stroke series. My name is Nikhil. I am the head of physiotherapy and I am an advanced neuro rehab specialist at PRS Neurosciences. So, let's get started. The first fundamental question, what is a stroke? Brain need a lot of blood. Brain is the most active organ in the whole body and it need constant supply of energy. Energy in terms of glucose, energy in terms of oxygen. This is all coming to the brain through the blood supply. So, when the blood supply is cut off, what happens? The brain cannot function and this will lead to a damage to the brain cells, which is called the neurons, and unfortunately once they develop the damage, it is damaged forever. So, stroke is an injury that is happening to the neurons in the brain because of lack of blood supply. The stroke can be divided primarily into two. One, if there is a cut off of the blood supply to a specific part of the brain, and the second one because of a rupture of a blood vessel and blood comes out from the blood vessels, that's a hemorrhagic stroke. When the blood is cut off, that's called an ischemic stroke. People develop ischemic stroke because of two reasons. One, over a period of time, the blood vessels which is carrying the blood to different part of the brain will become more and more clogged with atherosclerotic plaques or the fat cells, it goes inside the blood vessel and it makes the lumen of the blood vessels smaller and smaller, and one fine day that just cut off and the whole blood vessel will not be able to carry any blood to the brain tissue. The second cause is when the blood clot forms somewhere else in the body, for example in the heart, in the different chambers of the heart. It can dislodge from the heart and it travels through the blood vessels. Probably it may navigate through the big blood vessels because the area is big, but it goes and stick to an area where the blood, as the blood vessel becomes smaller and smaller, this go and stick there and it cut off the blood supply to the remaining areas. This is called an embolic stroke. Now, the hemorrhagic stroke. One of the main reasons for hemorrhagic stroke is something called an aneurysm. We all will have that experience when we try to blow a balloon. If the balloon has a weak part, when you blow it, only that part bulges. The same thing can happen to a blood vessel. When the blood vessel, some part of the blood vessel is weak, with each pumping of the heart, the weak part of the blood vessel get more and more and more and more dilated and it forms like a sac sort of thing. So, that is called an aneurysm. So, the wall of this aneurysm is very thin. So, it can break very easily and the blood can come out. That's called an aneurysm. Rare cases. By birth itself, there will be some problem in their blood network of the brain. This is called the arteriovenous malformation or AVM. It forms like a ball of blood vessels which may break at any point of time. It can cause stroke, or it can be because of a high blood pressure. The pressure itself can break the blood vessel and it can cause a hemorrhagic stroke. So, in a nutshell, stroke happens when the brain is not getting enough blood because of a clogged blood vessel or a ruptured blood vessel, and the clogging can be because of the atherosclerosis, or it can be some blood clot which is dislodged from other part of the body, And hemorrhagic stroke, it can be because of aneurysm, it can be because of an arteriovenous malformation, or it can be because of a rupture of the blood vessel itself. Now, you must have heard of something called a mini stroke, or in our medical lingo we will say transient ischemic attack, TIA. TIA is exactly like a stroke, but it recovers much faster. Usually within 24 hours it's expected to recover. It is in this, the blood vessel is not completely clogged, but it's definitely having some serious problem. So once they get a TIA or a mini stroke, the chance of they developing a full blown stroke, a complete ischemic stroke, is extremely high. Even if it's a TIA, please make sure you pay enough attention. Go to your doctor, meet them, resolve the underlying problems, correct the lifestyle, correct all the modifiable risk factors, so that you can prevent getting a full blown stroke which can cause a permanent disability. I hope this video was useful. For more interesting information about the stroke, keep watching our stroke series. Thank you.